right, we've got some good news in the fight against HIV. There is a new pre-exposure drug that has shown real promise as a once-monthly oral pill to help prevent HIV. So Dr. Isaac Crawford, a Touro Primary Care physician, joins us now to talk about this new breakthrough for his patient base, making it easier to prevent. And also, it's just more effective than ever. Dr. Crawford, thanks for being here.
Yeah, glad to be here.
Absolutely. So tell us what's so special about this breakthrough.
So, it's been very effective at preventing transmission of HIV, about 99% effective. The pill forms have been around for quite a while now, but now we're getting some long-acting options as well.
And when you say long-acting, how much longer does the patient get before you have to test again, treat again? Talk about that.
Right. So the testing and the initial setup is pretty much the same for all of them. You do your initial testing for HIV. It's very important to have a negative test before you start PrEP, and then also testing for other STIs. And then about a month later, you test again, and then it goes to quarterly testing for STIs based on risk, checking on tolerance,
right,
and then checking on adherence, because it's very important to take it on a daily basis.
Right, which is so common for patients. They feel better, they are living better, and then they just kind of forget to take it.
Right, and especially a lot of younger patients, it's their only pill, so it's pretty easy to forget that. So it's important to check in on adherence, and then that's when we talk about some of the long-acting ones.
Let's take it back to the basics here. What is the relationship between HIV and AIDS? What is HIV? How do you get it?
So HIV is the initial infection. You get it sexually transmitted disease. It's also, it can be any blood or body contact, body fluid contact, primarily blood, semen, those kind of things. Untreated, it can develop into AIDS, but the treatments have come so far that it's very manageable. It's still better to prevent it, though.
Absolutely. And you were saying something in the commercial break that's really important to mention here. This is a prevention for HIV. It doesn't cover all STDs here.
Right, correct. So that's why it's very important to continue screening every 3 months, and also being aware that you're still at risk for these other STIs, and to take additional precautions, condom use and everything else.
Absolutely. So talk about what your biggest hope is for this new HIV treatment, because it has been available since 2012.
Right.
So what's new about this that you say this really shows promise?
So we now have the long-acting ones. Apretude came out about 2021. That's every 2 months. And then recently there's another one that came out every 6 months.
Wow.
Yeztugo. So.
Wow.
Yeah.
So what do you tell your patients about access? Because access to care is a completely other conversation. To destigmatize, to get people to walk through the door. What do you want to say to that patient population?
Right. So access is widely accessible through most insurances and Medicaid and Medicare, under the Affordable Care Act.
Right.
Still should check with your insurance company, just make sure your plan covers it.
Right.
And then there's different coverages for each individual medication. So like the pills tend to be widely accessible, and then Apretude and the long-actings tend to take a little more work, but they've become more accessible.
Good to know. Dr. Isaac Crawford from Touro, thank you so much for being here today.
No problem, thank you.
All right.